Osteoporosis is progressive weakening of the bones and development of fractures. Some osteoporosis fractures may be silent, so anyone you know who may have lost height or have had intermittent back pains may well have osteoporosis. Osteoporosis affecting the hip is unfortunately very consequential. About 1,100 patients die every month following a hip fracture in the UK. That's about 10%. Another 10% don't survive the next 11 months. A quarter will go into an institution, and 80% who survive are not independent again. And yet, we could have identified those patients who go on to have a hip fracture decades earlier, and with simple interventions could have prevented the progression to the fracture and all its consequences. A multidisciplinary approach to osteoporosis can result in improved bone health and reduction of future fractures. Osteoporosis, fortunately, can be treated in a number of different ways, including lifestyle changes, which are the foundation of all treatments, and pharmaceutical interventions. Of the lifestyle, it's particularly nutrition, particularly vitamin D, and optimizing calcium and other nutritional factors. Exercise has a critical role to play too. Muscle strength is very directly coupled with bone strength, and by improving muscle tone and muscle strength, we're able to improve bone density and bone strength and prevent fractures. And there are a number of pharmaceutical agents which can be helpful. With these different interventions, we're able to reverse osteoporosis and reduce the risk of future fractures. Osteoporosis can be prevented. Our bones are changing throughout our life. They reach its maximum level of strength around the age of 35. And then we might lose bone gradually over time, precipitously around the menopause. About 5% of bone can be lost per year over a 4 or 5 year period. Interestingly, we also lose bone during any periods of inactivity and during pregnancy. 5% of bone is lost with each pregnancy. There are a number of factors that increase the bone strength or reduce bone strength throughout our life. Nutrition is a key factor, particularly vitamin D and calcium, but also exercise and muscle strength. As we lose muscle strength, we lose bone. Having excess alcohol also has a negative effect on the bone, and smoking can also reduce bone strength and produce bone loss and increase the likelihood of a future fracture. Certain medical conditions can also have a negative impact on bone health, be that thyroid, diabetes, inflammatory bowel disease, inflammatory joint conditions, or even treatments such as steroids. If you do have any of those conditions, it's important that they are treated appropriately to reduce the negative consequences on your bone health.